is Focus with Jack Caudill.
Good evening, I'm Jack Caudill. Welcome to this month's edition of Focus. This month we're talking about heart health, and two guests with us to talk about that this month. Matt Gross is a certified nurse practitioner with the Monument Heart and Vascular Institute, and Cody Murray is an exercise physiologist with Monument Health here in Rapid City. A little background here. February is American Heart Month, and the CDC says heart disease is the leading cause of death for both men, women, people of most racial and ethnic groups in the United States. They also say about 697,000 people in the U.S. died from heart disease in 2020. That is 1 in every 5 deaths. Coronary heart disease is the #1 most common type of heart disease, killing 382,000 people in 2020. More than 20 million adult Americans aged 20 and up have it. We're going to start with you, Matt Gross. Thanks for coming up. We're talking about heart disease. In a broad sense, what exactly are we talking about when we use that phrase heart disease?
So heart disease is a broad term that can encompass a number of different things, and that's my job more specifically as a nurse practitioner at Monument Health at the Heart and Vascular Institute. So what do we treat as far as heart disease is concerned? We can treat different arrhythmias that occur, things called atrial fibrillation, extra beats from the bottom of the heart, so kind of some electrical issues heart disease can include. We're also talking about blockages or plumbing issues, plaque in the arteries that can kind of build up and lead to problems such as a heart attack, which can lead to heart failure. So we treat electrical issues, plumbing issues, heart failure, more simple things as well, such as high blood pressure or high cholesterol. So really, when we are talking about heart disease, we're talking about a broad range of issues that kind of encompass it.
Now, we talked about statistics just a minute ago. Are you seeing some of those same overwhelming numbers in this area as we're seeing around the rest of the country?
Yeah, so I think you brought up an important point right away that heart disease remains the #1 cause of mortality in the United States. And that was true throughout the pandemic as well. So 2020, I think were your statistics, 2021 is the same as well. Heart disease remained the #1 killer of men, women equally. Both were #1. Cancer was #2. COVID was actually #3 in 2020 and 2021. And the 2022 CDC statistics are due to come out soon, but it's expected that heart disease is going to remain the #1 cause of mortality. So it's a very important topic, and February is the perfect time to do it since it's Heart Month.
And Cody Murray is an exercise physiologist at Monument Health. How does that part of this fit in with the whole heart health fight?
Okay, so with cardiac rehabilitation, we usually see the patients after they've had a heart event, heart attack, if they go through catheterization lab and have stents placed. We also see a lot of patients that have open heart, coronary artery bypasses, and also valve replacements or repairs. So we're after the fact. Once cardiac rehab really starts when they're in the hospital. So we'll work with them on the hospital floors. We'll go to their rooms, do heart disease education, tell them about the process of doing outpatient cardiac rehab, and we'll also get them up, ambulate them around the hospital floors while they're still inpatient to make sure they don't have any rhythm changes and help to just slowly build that process. And we'll also refer them out to our outpatient program. So phase 2 cardiac rehab is done on an outpatient basis. They come in 3 times per week. We exercise with them, provide some education, and help to put tools in their tool belt to hopefully reduce the risk of heart disease going forward.
Now, you're talking about a lot of different varieties of heart disease that we're looking at. What are some of the warning signs that people need to look out for, something that they shouldn't ignore?
Yeah, so warning signs for heart disease, for me, one thing that I look at as a clinician in the clinic when I see these patients is a change in how you're getting along. So Jack, for instance, you're outside for a walk, or maybe you do a morning walk every day, and it's never an issue for you. You're up here on Skyline Drive, going up the hill, up the parking lot into work, and every day it's no problem. But all of a sudden, man, something's different, I'm more short of breath. I'm developing, some chest discomfort. I simply cannot do what I used to be able to do just not that long ago. those are often warning signs for heart disease. Sometimes they can come on more suddenly, and you're probably not going to miss those, like sudden onset chest pain, chest pressure. We're sitting here right now, all of a sudden, I've got chest discomfort. So you can have, more gradual warning signs sometimes, like what I talked about, or it can be kind of sudden as well. And it's those sudden ones that we want to kind of pay attention to, so you can seek treatment before there is significant harm or damage.
So how do you know when it's something serious enough that I need to go to the doctor instead of, wow, what is that's going on?
So usually what I tell people when it comes to that question specifically, because it's a hard one, I had a calf cramp this morning. Is that my muscle just tired, or is that a clot in there? Well, I did work out yesterday, so a cramp probably makes a little bit more logical sense. But if you're having a symptom that is giving you concern, a lot of times it's worth checking out. So if you're personally, developing anxiety over it, and man, I think something is wrong, that should be a yellow flag for you that you should go get checked out. And that's the role of modern medicine, so we can run some tests. Is there something wrong? Is there not something wrong? And we can kind of help weed through that in a more formal process if you have concerns.
Is it a challenge sometimes to get people to take those signs seriously and not just kind of let them go?
And, that's a real individual response there, which is unique. Some patients, are a little bit more up on that. They like a partnership with their care provider, and if a new symptom arises, there's a lot of communication back and forth. Here in Western South Dakota, not to weed out a certain demographic, but ranchers, I think they just have a different mindset in general. Not all of them, not universally, but ranchers around here, I've noticed that time again. Cody probably has as well. They like to tough things out. They generally will maybe wait a little bit longer than they should, and then kind of come in kind of late with these problems that have progressed. The point is that there's a real individual experience as far as some patients seek care early, some seek it late. And we'd like to encourage patients generally to seek it early. That would be better. And even if you're just not sure, you just need that reassurance, we'll tell you, hey, things look okay. Go back to your usual activity. Go back to your usual routine.
Now, Cody, your area of expertise is exercise. How do you differentiate those normal aches and pains of exercise? They're going to pop up with something here that is going to need some extra attention when it comes to cardiac issues.
Yeah, so the biggest thing when it comes to normal everyday activities, if you notice that slow decline, you don't feel like you're able to do as much as you did previously. And in cardiac rehab, we see all walks of life, from 90-year-olds who just want to live independently and they've kind of noticed that starting to decrease, to people who run marathons and do triathlons, and they notice that slow decline in their ability to do their everyday tasks. So that's how you can kind of tell that something might be becoming more of a problem, is that day to day it's just getting worse, where on the exercise side, if you do a strenuous workout the day prior and then you're a little short of breath on your next one, your muscles kind of hurt, kind of tone it back with your exercise intensity and see if it's just an acute problem. But more or less, it's going to be the chronic changes, days, weeks, months, where you start to slow down and really notice that you're having signs and symptoms of fatigue, energy loss across the weeks.
So it's not just those sharp chest pains that you would,
correct,
a lot of people would think of, if I'm not having that, I'm good to go.
Yeah, correct. I really think, like Cody said, a decline in your functional capacity is a key component. 3 months ago, I could go up 2 flights of stairs, no issue. Today, I go up 4 steps and I'm short of breath. I get chest discomfort. I have fatigue, profound fatigue. Heart palpitations, my pulse rate is up. Those can be warning signs as well. Ideally, before we get to that point, we prevent heart disease from happening at all, which I'm sure we'll get into from a lifestyle standpoint. But yes, when it comes to heart disease, those are some of the warning signs. A decline in functional capacity is a big one.
All right.
That can manifest as increased shortness of breath, fatigue, just not feeling well, generalized malaise.
Okay, we do have to take a break. We will continue and look at some of those risk factors and prevention when it comes to heart disease when we return with this month's edition of Focus. Welcome back to this month's edition of Focus. I'm Jack Caudill. We're talking about heart health. This February is Heart Health Month. Matt Gross is a certified nurse practitioner with the Monument Heart and Vascular Institute. Not everybody is at the same risk level when it comes to heart disease. What are some of those risk factors that people need to keep in mind, knowing that they need to keep an extra good eye on this?
Yeah. So there's different risk factors for heart disease out there. I'll probably let Cody talk a little bit about the modifiable and non-modifiable risk factors that are out there. But they include high blood pressure, family history, diabetes. We'll talk more about that. But then there's also a different set of risk factors that are behavior-based. And there's 5 of those that I just kind of keep in the back of my head. So there's 5 behaviors that basically we can modify to reduce our risk of heart disease. And those include exercise, nutrition, stress management, sleep, and then exogenous molecules, which is basically medication to control some of those risk factors that exist, which would be high blood pressure, diabetes, high cholesterol, things like that.
Now, he mentioned some of the variable factors, as Cody Murray is an exercise physiologist at Monument Health. What are some of those risk factors that you can control from an exercise point of view?
Yeah, so from an exercise point of view, we have a couple different risk factors that we can control. So we can manage high blood pressure with exercise, because our heart's really just one big muscle. The more you exercise a muscle, the more in shape it's going to be. It's not going to have to beat and contract as hard to get the blood out to the rest of our tissues. So with chronic exercise, we can help to reduce our blood pressure. We can also help to control our lipid panel with exercise. So exercising, increasing our metabolism. It can also help to reduce our risk of diabetes, or if you are diabetic, help to control our blood sugar, because our basic source of energy is going to be glucose, or that blood sugar. So the more you exercise, the more energy you're going to be using up. So over time, we can actually see our glucose control go down as well. And then overweight, obesity, it's kind of an epidemic in our population nowadays, but the basic factors are the calories in minus calories out. We want to be at net zero, or if we're trying to lose weight, we want to be, in the negatives with our calorie control. So exercise is a great way that we can control our calories by expending that energy, and just overall chronically working out can help us to reduce our weight, and then also the rest of the risk factors of heart disease.
Now, you mentioned diet in that, where you're looking about a heart-healthy diet. What is a heart-healthy diet? What foods are on the good side? What foods are on the bad side?
Right. That's an interesting question. There's a lot to that, of course, but I think it's important to kind of simplify that, because there's lots of observational studies out there on eggs. Eggs are good, eggs are bad, and coffee consumption. Boy, I should drink coffee. No, I shouldn't drink coffee. How about a little bit of alcohol? Is one drink okay? No, yeah, that's probably okay, maybe, it's kind of the research, right? But I think we can simplify a lot of this by focusing in on what I personally call the kindergarten rules of health. Let's go back to grade school. What did they tell you? Eat your fruits, eat your vegetables, eat some meats, absolutely, and avoid the junk. Avoid the Doritos, the Cheetos, the Fritos, the SpaghettiOs, the Mountain Dew, the Pepsi, the cake, and all that. So I think as a population, to our listeners out there, if I asked you, what should you eat? I bet 99% of people could answer that question correctly. The real thing is doing it. We know what to do. We just have to do it, which is much tougher. Food is entertainment in our country. I see it all the time. I see it in the public schools. I see it at my own work, even at the Heart and Vascular Institute. We're guilty of it sometimes, right? It's somebody's birthday. It's a party. It's a celebration. And, we have to be cognizant of that and try to kind of fight back on some of those environmental factors that kind of make us, be around some of that food and consume it.
Now, obviously, you would like to prevent heart disease more than you would like to fix heart disease. Right. Are there some other big aspects of prevention that people should keep in mind?
Absolutely. So back to what Cody talked about, exercise for a second. I want to hit on that because that really is in a league of its own when we're talking about preventing heart disease. There's probably no greater risk factor for heart disease than physical inactivity. So exercise, like he said, it affects everything. It affects your blood pressure, it affects your diabetic control, it affects your cholesterol. So that really is the big one, but there's other ones as well. Nutrition, stress, sleep, and then controlling your risk factors with medication, seeing your doctor. So stress and sleep, we could talk about a little bit as well.
Now, Cody, he's talking about the importance of exercise. When we talk about exercise for prevention, does it have to be hitting the gym for a hard workout, or can that just be taking a walk, getting the dog out and walking around the block a few times?
Yeah, so exercise, it's one of those kind of words that scares people off some of these days with, oh, I have to go to a gym, I have to exercise, on a treadmill, and that's not necessarily the case. The biggest difference is we have physical activity and we have exercise, and there's a difference between those two key terms. Me just walking around work, going from one room to another, going to see patients on the floor, that's going to be physical activity, and it all adds up throughout the day. But with exercise, it's more directed, it's planned, so we have a specific duration that we're trying to hit. It's focused. We're actually meaning to go out and get our heart rate up rather than just walking around the house or in the hospital. So we're really looking at trying to get in 150 minutes a week of directed exercise. And that doesn't mean that you have to go out and get a gym membership and go to the gym 5 days a week. If you go outside, take a 10-minute walk, because exercise has to be in at least a 10-minute burst of activity. But 30 minutes a day, 5 days a week of just walking around the neighborhood, you're hitting that bare minimum for exercise.
Is that old adage true, the one that the best exercise is the one you actually get up and do?
Yep, exactly. So there's no right type of exercise. Some people like treadmills, some people like bikes. Other people, especially in this area, like to go out hiking. And all of those, as long as you're getting the heart rate up, you're working out, you're doing something that's not inside on the couch, just in your house, then that can count as exercise.
All right, we got to take another break. We'll continue our look at heart health when we continue with this month's edition of Focus. I'm Jack Caudill. Welcome back to this month's edition of Focus, talking about heart health this month, which is February is American Heart Month. Matt Gross is a certified nurse practitioner with the Monument Heart and Vascular Institute. How have treatments evolved for heart disease? How different are they now? What can we do now that we couldn't do 10, 20 years ago?
Man, the technological evolution of our society is just amazing in cardiology. Alongside the research, we know how to treat many of the problems out there. Back to the lifestyle stuff, just for an example, 30, maybe 40 years ago, rehab for heart disease used to consist of laying around the house. You need to rest. Now we know that the people that didn't listen to their doctor back then, as in the ones that got up and were more active, had a lot better outcomes, which is how the genesis of cardiac rehab was basically born. Now you go to cardiac rehab after a heart event and you exercise, which is pretty incredible. That's a 180 there. But more specifically, from a technological standpoint, we can put stents in the heart. You come in with a heart attack early, we want to open up that blockage. You can literally put wires up inside the vessel, get to that blockage, expand it open, and get blood flow to the heart. Medical treatment has progressed tremendously. There's a lot of pharmaceutical companies that have come up with amazing products. So if somebody has a damaged heart, we can put them on medicines that help that recover and pump much more efficiently. So there's a range of new things out there, from behaviors to medications to devices that we utilize to increase the capacity of the heart, whether that's a pacemaker, a cardiac stent, or even external devices that act as a pump in some cases. So we've come a long ways, and it continues to evolve very rapidly.
Cody Murray is an exercise physiologist with Monument Health. You're running cardiac rehab. How is that evolving over time?
Yeah, so like Matt pointed to, in the past it was bed rest, take it nice and easy, but now we actually start when they're still in the hospital. So if they've had a stent, as long as they are off bed rest, which is typically about 4 to 6 hours after they receive that stent, we're in their room, we're getting them up, we're moving them around. Same thing with open heart surgeries, where before they'd be basically on flat bed rest for quite some time, but now as soon as they're stable enough to stand up, we're down on that ICU, getting them out of bed, walking them around the hospital pod, increasing that duration from time that they are in the hospital. And then afterwards, we try to get them into our outpatient program, which is 36 sessions, covers about 12 weeks, 3 times per week. We try to get them in about 2 weeks at the max after they've received their heart intervention. So it's kind of evolved that we now see the benefits of increasing activity right away, so we can help to expand that perfusion of the heart and get good circulation. Because like we mentioned earlier, the heart's one big muscle. We want to make sure that we maintain that muscle without having them just sit around and become deconditioned while they're recovering.
Now, cardiac care recently in the national spotlight with Damar Hamlin of the Buffalo Bills. Goes into cardiac arrest during Monday Night Football, is revived. How much does something like that create attention and awareness, especially when you see a guy who should be in absolute peak physical condition be hit with something like that?
Yeah, so maybe there's a couple net positive lessons there, and thank God he's doing okay. You know, it sounds like he gave an interview last weekend. I didn't get to see it, but I'm glad he's back up on his feet. And without some of the progress within the medical field, maybe that wouldn't have been the case, you know, a couple decades ago. So with him, a little bit more specifically, he created a narrative that we can kind of follow. You know, it's important to get checked out by a doctor. It's important to be prepared if an event happens. For him specifically, probably what saved his life is having a defibrillator on the edge of the field there. And that's kind of the lesson. They were able to come out. He was in an abnormal rhythm that needed shocked and get him back quickly. So a public health narrative maybe could be, you know, we need more defibrillators in society. We need funding for that. We need them down. I think they're at the Civic Center and various local churches and schools. But we probably need to expand that, maybe develop more awareness on where these things are located and how to utilize them. So that there definitely is a net positive there because millions of people saw that. And it was an incredible event to see him you know, kind of come out of this and recover from all this as well. So
now we got about a minute to go. We were talking during one of the breaks about, you were talking about how amazing of a machine the heart really is.
Yeah, absolutely. And why do we need to take care of it? It's this amazing organ. You know, it pumps, average adult has 4 to 5 liters of blood, and it's pumping that entire volume of blood at least once a minute. So 5 liters of blood a minute, which is about like a kitchen faucet. So if you're at home, go turn on the kitchen faucet. That's how much blood your heart is pumping every minute. And it beats without getting tired. I mean, 60 to 100 times a minute, your whole life, it doesn't take a break. If I lift weights in the gym, 10 reps, my bicep needs a break. The heart just keeps beating, you know, several million times a year. It's just incredible.
All right, we are out of time. Matt Gross, Cody Murray, we want to thank you guys for coming up. Again, reminding people that heart health care is out there. You guys were set up to deal with pretty much anything here?
In Rapid City, absolutely. We want to prevent heart disease, but if you need treatments for it, Monument Health is a phenomenal facility with lots of knowledge and the latest technological innovations. We'll take good care of you.
All right, we are out of time. Thank you guys for coming up. Thank you for joining us. Hope to see you again the first Sunday night of next month with our next edition of Focus. Good night.